Good afternoon, beautiful souls. This is Essie. Today I'll be talking about my functional therapy that involves medication management. After reading about each approach and how they can be utilized, I noticed one big trend about them. Each approach could be used simultaneously and or interchangeably with each other. The activity today that I will be talking about is geared to assist patients who have difficulties with memory, orientation, and sequencing. And for the purpose for this assignment, the two goals that will be addressed are for individuals who are considered to be on levels 2 to 3 GDS and 4 to 5 GDS. As you can see from my mild impairment goal, I state that patient will recall medication names, purpose of medication, time taken, and dosage at 100% accuracy with given minimal to no visual cues. Now, with my modified goal for my moderate impaired, I state that with use of medication list, patient will sort 3 or more medication into a pill box with given moderate verbal and visual cues at 80% accuracy. Now, how to target the mild goals. Now, you have to remind yourself with our mild dementia patients, they still have the receptive and expressive language intake, so they're able to read and understand. So I would have the patient read their script order. And for those who don't know, script order is just another way of saying prescription. I would have the patient read their script order, and then I would have the patient identify when each medications are to be taken. Then, once the patient has identified when each medications are to be taken, I would have the patient sort their medication into a pill box. So once the patient has finished sorting each medication into their designated pill box, I would then have the patient recall the medication name and the purpose, the time, and the dosage per each pill box. Now, for the skill of daily notes for the mild impaired, I state that I, as a clinician, reinforce use of spaced retrieval strategies for increased recall of medication's name, purpose, time taken, and dosage. Spaced retrieval training successful at 30 seconds, 1 minute, 2 minutes. 4 minutes, the patient only could do it twice. Patient struggled with memory skills over 4 minutes. Now, with that being said, with my patient not being able, another way I could have modified, or I could modify this particular goal or activity would be, instead of having patient recall medication name, purpose, time taken, and dosage, I could probably reduce reduce it to where the patient will recall the medication name and time taken. To help the patient, and this is to help gear the patient and have the patient understand when they're supposed to take their medication so they don't lose track of their time of when they're to take their medication. Now, to target the moderate goal, I state that I, the clinician, will label and read each script order to the patient. Now, once I read and label each script order to the patient, what I would have the patient do is identify, using the visual stimuli, have the patient identify when the medication is to be taken, and then I would have the patient sorted again in their pill box. So, and I also color coded the schedule, so to help the patient understand, like, the red one is for your diabetes medication. The yellow one is for, I don't know, your hypertension medication, or your high if you have high cholesterols or whatever medication they're taking. I color coded it to help them see, to help modify if they can't read the script, or they can't read the name and don't know what the name is for, giving them a visual stimuli with colors to attach with the medication can help with patients who are considered to be in the moderate GDS 4 to 5 or higher level. Now, my daily skill note for the moderate impaired would be the clinician, which is I, facilitated a 3-step sequence activity using a Montessori based approach to improve patients' ability to organize patients' pill box. Patient participated organizing medication using placebos according to his ordered script, which is his prescription. What his prescription may say twice a day you take your high blood pressure twice a day, I don't know, hyper diabetic pressure once a day. So according to the script, until he is able to replicate the sequence with 80% accuracy. And of course, with his impairment and his level, I would be giving him moderate to verbal cues. And of course, the visual stimuli with the calendar would also help as well. Um, I hope this was very informative. Bye.